So today we are diving into a substance that's been nicknamed the God molecule. And honestly, it's at the heart of a really fascinating scientific mystery, one that could totally change how we think about the brain. We're going to follow the clues and see if this thing might just be a radical new kind of brain reset. And our story kicks off in, well, a pretty weird place. We're talking about the defense goo of the Colorado river toad. Yep, a super potent, naturally occurring psychedelic. But the real story isn't where it comes from. It's where it might be headed. Because that very same substance is now being seriously studied for its power to rapidly treat depression. I mean, the journey from a toad's back to a high-tech lab is just wild, right? But it really sets up the central question we're digging into here. Okay, let's give it its proper name. 5-mesh-DMT. It's a tryptamine, so it's a chemical cousin to some more familiar psychedelics. But its main claim to fame? It's speed. A psilocybin session can last, 6 hours? But a 5-mesh-DMT experience can be over and done in 15 to 30 minutes. Just think about what that means for therapy. A clinic could potentially help a bunch of patients in the time it takes for just one traditional psychedelic session. But here's the catch. The more scientists look at 5-MeO-DMT, the more they realize it just doesn't play by the same rules as other psychedelics. It's a total outlier, an atypical psychedelic. So let's get into it and unpack the research that lays out the clues to what makes this molecule so profoundly different. All right, our first clue is hidden deep inside the brain's wiring, in its pharmacology. It's all about which doors, which locks this substance opens up in our mind. Okay, so super quick primer. Just think of your brain as having millions of tiny little locks on its cells. We call these receptors. Psychedelics are basically like keys that fit into these locks and open up new ways of seeing things. For this story, you only really need to know about two of them, the 5-HT2A receptor and the 5-HT1A receptor. And here is the fundamental difference. The 2A receptor, the one on the left, that's the main playground for classic psychedelics. We're talking LSDs, psilocybin, you name it. When you activate it, it generally fires things up, causing excitatory effects in the brain. But 5-MeO-DMT, it overwhelmingly prefers the lock on the right, the 1A receptor, and activating that one does the exact opposite. It calms things down, causing inhibitory effects. This is our first major clue that we are dealing with something completely different here. And this chart really shows you just how different we're talking. We're looking at something called the selectivity ratio. Basically, a smaller number means it really prefers that calming 1A receptor. So look at psilocybin and LSD. They kind of like it. But now look at 5-MeO-DMT. It's not a preference, it's a full-blown obsession. That number is so tiny, it's in a completely different ballpark. What this means is that this molecule is hitting a fundamentally different switch in the brain than all its psychedelic cousins. So if it's hitting a totally different switch, what in the world does that feel like? Well, that brings us to our second clue, the user's experience itself, which is often described as a journey into, well, nothingness. You know, classic psychedelics are famous for what researchers call rich sensory phenomenology. That just means complex visions, crazy geometric patterns, vivid imagery. But 5-MeO-DMT is often the polar opposite. Users frequently talk about something called a whiteout, a sense of a void, of their ego completely dissolving into a state of pure nothingness, and often with total amnesia of the experience afterwards. And this gets even clearer when you put it side by side with its closest chemical relative, DMT. I mean, they couldn't be more different. DMT is famous for being incredibly information-rich. You hear stories of people meeting entities or visiting other worlds. But 5-MeO-DMT? It's characterized by a lack of memory, that void, and a super intense body high that people often describe as a near-death experience. Two molecules, two totally different worlds. And the mystery just gets deeper when you look at the physical side of things. People on 5-MeO-DMT can have these intense, involuntary actions, jerking, twitching, even screaming. And here's the kicker. They often have absolutely no memory of doing any of it. It's like the conscious mind just checks out while the body goes through this huge, uncontrolled release. So, let's recap our clues. We've got a preference for a calming brain receptor that's packed into the temporal lobes. We've got an experience of amnesia and nothingness. And we have these intense and voluntary physical movements. So where does all this lead? To a really startling and powerful hypothesis. The researchers behind our source paper asked this exact question. When you stack all the evidence up, the specific brain region it's hitting, the total memory loss, the uncontrolled motor stuff, does it start to look less like a classic psychedelic trip and maybe more like something else? Something Seizure-like? And this is where the theory gets incredibly convincing. Just look at this. The experience of 5-MeO-DMT on the left lines up almost perfectly with the known symptoms of a specific kind of seizure that starts in the temporal lobe on the right. Both can have intense emotions, memory loss, and these involuntary movements called automatisms. And get this, both are often described by the people who go through them as being profoundly intense and even spiritual. The overlap is just uncanny. Now, I know the word seizure can sound pretty alarming, but it is so important to reframe this in a therapeutic context, which brings us to electroconvulsive therapy, or ECT. This is a totally mainstream medical treatment where doctors on purpose induce a seizure to treat severe depression. And guess what? It works. It's one of the most effective tools we have. So the takeaway here is, if 5-MeO-DMT is causing seizure-like activity, that might not be some dangerous side effect. It could be the very reason it works so well as an antidepressant. Okay, so the final clue in this whole mystery doesn't even show up during that quick 15-minute trip. No, it emerges days or even weeks later as these strange little echoes of the original experience. They're called reactivations. And we're not talking about the colorful visual flashbacks you might think of with LSD. It's different. People report suddenly re-experiencing the bodily and emotional parts of the trip, like a sudden wave of bliss or terror, or a weird physical sensation, long after the drug is gone from their system. And this might be the most dramatic piece of evidence of all. Just look at how often this happens. In clinical trials, classic psychedelics cause these echoes in less than 10% of people. But in studies of 5-MeO-DMT use out in the real world, that number skyrockets to as high as 73%. This is not a small difference. It is a massive signal that something fundamentally different is happening in the brain after 5-MeO-DMT. So what could these reactivations possibly be? The paper puts forward a really compelling theory. They could be a type of focal seizure, what neurologists sometimes call an aura. A little localized burst of seizure-like brain activity, just echoing through the brain days later. So we followed all the clues and landed on this pretty powerful hypothesis. But what does it all mean for the future of 5-MeO-DMT as a medicine? It's really important to remember this is a scientific hypothesis. It's a framework for understanding, not a final judgment. Right, so the point of all this research isn't to scare people or stop development. It's the exact opposite. It suggests that, kind of like ECT, the seizure-like activity might be the very thing that makes it work. By understanding this unique mechanism, by embracing how weird it is, we can learn how to use it more safely and more effectively. This isn't a red flag. Think of it more like a roadmap for future research. And that really leaves us with one final big question. The mystery of 5-MeO-DMT shows us that we are stepping into a brand new frontier in neuroscience and mental health. The potential is absolutely enormous, but so is the unknown. The challenge for science, and really for all of us, is to chase that potential with both courage and a deep, unflinching commitment to understanding exactly what these powerful molecules are doing inside our most precious organ, the human brain.